Hello and thank you for coming to my presentation, Senator. My name is Lindsay Davis and I am currently an advanced practice registered nurse. However, I am returning to school now to pursue a doctoral degree in nursing with a specialization in nurse anesthesia at Duke University, here in North Carolina. I am here to discuss the role of CRNA providers and how we can provide quality and cost-effective anesthesia care in our state.
What is a CRNA? Can you describe the process of becoming a CRNA and how are CRNAs trained?
Certified Registered Nurse Anesthetists, also referred to as CRNAs, are another form of advanced practice registered nurses. They are specifically trained to provide quality anesthesia and pain management services. All CRNAs must complete a 4-year bachelor's degree in nursing first. They then must work for a minimum of a year in an intensive care setting prior to admission into school. Once in school, they complete a graduate program, which averages 30 months. During their program, they receive training in all types of anesthesia, including general surgery, obstetrics, pediatrics, and pain management, just to name a few.
What's the difference between an anesthesiologist and a nurse anesthetist?
Good question, Senator. As mentioned earlier, CRNAs are advanced practice nurses that practice under the nursing model and are governed by the Board of Nursing for the state in which they practice. Anesthesiologists, on the other hand, are physicians that specialize in anesthesia and are governed by the Board of Medicine. These physicians undergo 4 years of undergraduate education and then an additional 4 years of medical school. Once these are completed, they then complete an additional 3 to 5 years of residency and fellowship. It is important to note that both parties are trained specifically in anesthesia. Both parties must take a certifying exam in order to practice, and that both provide the same anesthesia services.
So, why would I want a CRNA over anesthesiologist?
It is important not to focus on why you would want one over the other. It is important to note that there is no difference in patient outcomes between the disciplines. With a shift in health care in the upcoming years due to the Affordable Care Act, more than 30 million people will be entering the health care system because they now have coverage for health care. This means that more anesthesia providers will be needed due to the increase in procedures requiring anesthesia.
Okay then, Lindsay. Please explain to me why you are here.
I would like for you to work with me to remove physician supervision from CRNAs, usually referred to as the opt-out. In today's age, anesthesia is 50 times safer than in the early 1980s. In addition, many studies have come out saying that there is no difference in safety and that we are more cost-effective.
Well, now you have piqued my interest, Lindsay. What exactly is supervision?
Supervision is the oversight of a non-physician anesthesia provider by an anesthesiologist to direct or monitor anesthesia care. While the Board of Nursing doesn't require this, the Federal Centers for Medicare and Medicaid Services require this. However, there is a provision that allows for states to opt out of this, if the government feels it is in the best interest for their state.
Talk to me about this cost-effectiveness.
Currently, CMS reimburses at the same rate for non-medically directed and medically directed CRNA services. By having CRNAs supervised, an additional provider is added, thus increasing the cost to the patient, hospital and healthcare facilities considerably. According to the Lewin Group, having a supervision model is 25% more expensive than a sole CRNA provider. With the addition of 30 million people to the health care system from the Affordable Care Act, we must find ways to improve access to health care for patients while not burdening the system. By allowing for CRNAs to practice without supervision, the system, the government, and ultimately the taxpayer would make a huge difference in the payment solution.
That sounds all good, but how exactly does this affect the state of North Carolina?
In North Carolina, 1.5 million anesthetics are given by 2,400 CRNAs annually. According to the RAND Group, there is a recognized shortage of CRNAs and anesthesiologists nationally and more specifically in the state of North Carolina. However, it is projected that in 2020, there will continue to be a shortage of anesthesiologists, but CRNAs will be plentiful. A shortage of anesthesiologists would prevent CRNAs from giving the care they were trained to provide.
I had no idea how much anesthesia was provided by CRNAs in our state.
Yes, sir. We provide over 85% of all anesthetics in rural areas too. Rural areas are more likely to employ CRNAs due to the ability to recruit to these areas and their decreased overhead for the facility. As we discussed earlier, patient safety isn't affected by this and it allows for more access.
How are we going to have a surplus of CRNAs here in North Carolina?
North Carolina is a great state to live in. It is estimated that over 80% of all in-state graduates stay here to continue to provide care to those in their home areas. This promotes a large group of CRNAs that have a vested interest in the state and in the care they provide to our residents.
I completely agree with your reasoning, Lindsay. Can you sum up our conversation in a few short points so I can share them with my colleagues?
Absolutely. CRNAs are vital to our state and to providing anesthesia services to our residents. Currently, we have a required supervision of CRNAs by physicians due to the Centers of Medicare and Medicaid Services regulations. If we choose to opt out of the supervision requirement, we can be part of the solution. With the large influx of new insured patients, the government and health care system can cope with the increases while not costing any more to the taxpayers. Thank you for your time, Senator. Please let me know if you need any more information and please don't hesitate to contact me for anything.
Lindsay, it was a pleasure and again, I am in agreement with you and I look forward to meeting again with you soon. Hopefully with more movement toward the solution.